of your body and how to get into better shape, clarify a little bit what matters around like toxins in your mouth, about your lymphatic drainage system, about fascia. So all these different things, and I would like to welcome my panel. Here we go. Come on, guys, don't be shy. Here we go. Hey. So in no particular order, let's just start. Amber, please go ahead. 30 seconds. Awesome, here we go.
Hi, I'm Amber. I'm owner of Facial Lounge in Orange County. We are the #1 spa in Orange County and Newport Beach. We specialize in skincare and the best facials. We also do lymphatic drainage facials. Yeah.
Companion, market companion. Let's do this.
Yes.
Wonderful.
Hi everyone, I'm Dr. Ben Javid. I'm a biological dentist. We've been hearing a lot about this topic from a lot of different speakers about biological dentistry and the importance of it, so we'll touch base more on that today.
Wonderful. And you're not only doing dentistry, right?
No, we're actually, we feel like doing biological dentistry is really important, and it's a big part of your overall health, which will, if you don't know enough about that, we're going to get into that more. But we feel like that in order to achieve our goal of optimal health, or to get there as close as possible, we need to bring the medical side into it as well. And I think there's a big disconnect in modern medicine right now. They think the mouth is totally disconnected from the body, and it's totally not true. It's actually upstream to your health. So if you fix there, we believe, then your overall health improves. But the vice versa is correct too. If you improve your systemic health, then it has a huge impact orally. So we want to bring that together. So we're building a new facility right now that's bringing all that together in one facility called Smile Body, and it's coming from a holistic biological perspective as well, and bringing that medical dental side together. We're going to have a lot of biohacks there, IV, red light, hyperbaric, and of course the biological side of dentistry as well.
Wonderful, thank you. Holden, what are you doing? Do you have a microphone?
I think it's attached to me, so we'll go from there. But my name's Holden Zalma. I own a company named MetaTouch Body Balance. We're based out of Culver City. We've been there for over 30 years. We perform holistic body work and targeted personal training. Our whole goal is to see not just what's going on with somebody, but where's the pain coming from. So we're not symptom people. We don't want you to come back 600 times and figure out, forever. We want, why is it happening? What can we do to get you out of that? And here's the tools to stay that way. So
wonderful. Yeah, that's the only way, right? So we can't just get painkillers and fix symptoms. We have to understand. And by the way, understand is one of our company values, because I truly believe if you don't really understand what a problem is, every fix is just going to be useless. So Tatiana, what did you do?
Hi, I'm Tatiana. Thanks for having me here today. I specialize in body contour and lymphatic massage. I own a spa called Brazilian Beauty Bar in Encino. It's a method that I went to Brazil to study, as it's done very differently there because we're vain. I'm from Brazil, it's Vanityville, and it's more aggressive than your typical water or very soft touch method.
Wow, that sounds interesting. So how is it more aggressive? Like, what matters? So maybe 30 seconds about lymphatic drainage, and we heard it over there as well. Like, what is it, why does it matter, and what to look for to get a good one?
Okay, so we each have about 12 liters in our bodies of lymphatic fluid and 5 liters of blood. So it's a far more important portion of your body, and that fluid can only move when we move and breathe and have muscle contractions. And so in all of us, it becomes very stagnant. So the water method, you're basically doing this. You're not really moving much. It's always a time. And then the method that I went to study in Brazil, it's done all by hand, and it's firmer. It's a lot more pressure. It's done with oil or lotion versus dry, and it's also the order. The order in which you do it makes a difference because fluid moves in our bodies in a certain way. So you kind of want to follow that river the way that it goes.
So much deeper, much more involved, really moving the fluids.
Correct.
Very cool. So, Amber, when you guys are like, also, what I heard a lot here, like, you know, on this panel is like the whole like concept of holistic, like not just fixing like an individual piece. So, what variety of services are you guys offering in your spa?
Well, thank you for asking. I have been part of something called the Susan Samueli Center for Integrative Medicine. I don't know if anyone's heard of it, but it's based in Newport Beach. They just built a 500,000 square foot facility in Irvine. And so I was behind the scenes in a lot of holistic studies. And so I base a lot of the stuff on, I've been a board member for 16 years, so I've been behind the scenes on a lot of the stuff. This event was so exciting for me because I didn't realize how many people are doing something. I mean, I know it, but it's so nice to be in a room with people who are doing so many amazing things. So Facial Lounge was behind the scenes on a lot on gut health and gut biome with skin. Lymphatic drainage is one of my favorite things. We only do face, so we don't do body. And the Brazilian way is the best. It is my favorite. I've been to a lot of places. I cannot wait to go to her place. I will be making my way to Encino. But Facial Lounge is very unique. We do all custom organic vegan facials, and we kind of follow what people need. A lot of people are signing up. I've been in business for 24 years, and I've been in skincare for over 30 years. So I was a buyer for Mother's Market in Orange County in the 90s. I was one of the youngest people, and I went to UCLA for cosmetic ingredients, and I met a lot of people through that, and that's how I kind of got into skincare. But skincare was my passion, and I found out that most aging products are causing acne, and most acne products are causing aging, and I had severe acne. So even though all the natural stuff, this is a long time ago, we've come a long way, was mostly breaking people out. I always wanted the natural products, but they weren't studied. So Facial Lounge curates skincare and facials off what people need, and it's very exciting because I see it more and more, but we are one of the first to ever do it.
Very cool. So what I like here in general at this event is we are all doing different things, but there's not a competitive vibe. There's like, okay, we need this, we do, and then this builds on top of this, and this builds on top of that. So love that. Let's keep that. That's really, really cool. What we haven't really done yet is like, so Holden, what are fascia really, and what matters here, and how are you working with that?
So I work a lot with fascia. If you don't know what fascia is, think of it like a wetsuit that goes over the whole body, holds all your muscles, ligaments, bones, tendons, nerves, everything in that sheath. The problem is when you hurt something, let's say this is your muscle, this is your fascia. If the muscle contorts, the fascia will too. The problem is the fascia will then scar and adheres, and the fluidity goes away. That's now locking that in place so that it can't do its normal functionality.
So you're limiting motion, basically.
It's limiting range of motion, it's limiting blood flow, its functionality. A lot of people think there's an entire neural net associated with it, so you've got emotions that are trapped in there. So it affects everything. So the way that we work is if we can unravel that tissue so the normal stuff underneath it can do its normal functionality, that's the benefit. Then you get long-term results, opposed to if I'm just gonna beat the crap out of the muscle for a long time, you're gonna get inflammation, you're gonna get irritation, and then the problem is still there. So that's why we get back to the car and everything feels like crap again. So what can you do to unravel that tissue so that the body can remold into what it wants to be and function more in a highly state?
Interesting. So also the question of really understanding where the problem is coming from, fixing it there, and then you can take it from there.
One good example I get is I get somebody who has migraines, and they've been treated by every medical professional in the world, drugs, injections, so on and so forth. I take a history, I realized they sprained their ankle 6 months ago. What that did is they started walking funny, then their hips went off one way, and their shoulders went off, then their head did. And what that did is that created this chain reaction of an imbalance that then gave them migraines. So I fixed their foot and the chain, and the migraines go away. So it's a different way of thinking, opposed to this is where it hurts, this is what I gotta do. If you can find somebody that says, all right, well, let me look at you as a whole opposed to a body part, that's where the real benefit and that's where the real healing comes through.
Wonderful. So when you said, like, you know, hey, toxins from your mouth, like,
Same
you know, the same thing, right? So same topic, right? So where does it start? Where does
Perfect
it end?
segue, perfect segue.
Yeah. I don't know how I came up with this.
It's
Go ahead.
That's so true. I mean, the thing is, most people, I mean, I said a biological dentist. I'm not sure how many people here know what that is compared to a regular dentist.
Yeah, give us 30 seconds, please. Go ahead.
Well, it's really about looking at the body as a whole, and not just as teeth. And we're very conscious of what materials and what solutions we use to actually heal. So we don't believe in root canals, for example, because for many reasons they're releasing toxins that are directly linked to cancer, heart disease, arthritis, dementia, and cavitations are a big link. Those two things together are just a source of so many health issues. Safe mercury removal. These kinds of things are kind of the staple of a biological dentist, but more importantly, we're thinking about how we can get our patient healthy from within first. So that's the main premise of what a biological dentist really focuses on. But on a daily basis, what I do now is really look at cone beam CT scans of patients and look for what toxicity is there and what is seeping into their system. Because, I mean, we're all here at a biohack seminar, and we're trying to achieve optimal health and vitality and longevity. And whether it's through, biohack things like red light or, other things that we do, or nutrition, if we don't stop the valve of toxicity coming into the body, that's your first step. It's Dr. Pompa's first R. If you don't address that, you're not going to get healthy. You have to first address the mercury, or the mold, or whatever else. In our case, it's going to be the root canals, cavitations, and mercury. So those few things right there is where we focus on through the help of a cone beam scan and find the toxicity. Because the body is amazing, as we all know here. The body is amazing. If we actually stop the toxic load coming into the body can heal. It doesn't need a lot of external factors, or even beauty. We're talking about beauty in this weekend here, and beauty is not necessarily. We don't need. These wonderful plastic surgeons are on this panel today, and a lot of times, what I believe in is how you get beautiful is actually getting beauty from within and get healed from within, and actually get to a place where you have better skin, you have better hair, you have better vitality, and you're beautiful. I mean, that's what really is attractive in the first place.
Can I make a real quick point?
Go for it.
I have a lot of friends that are in the hacking side, so they're doing the red light therapy, they're doing the cold plunges, but then they come to me with all these issues, and I said, what are you eating? What is your lifestyle like? Have you slept in the last week or two? These are things that are, we keep trying to shove chemicals or all these different hacks to get better, but we don't look at the basics. Are we taking care of ourselves? Because that's where beauty comes from. It comes from if I'm happy and I'm healthy and I'm eating good. If I eat a whole pizza, I don't feel good because my whole body just said, I hate you now. So it felt good for a minute, but then after that it went bad. So there's so many different factors that can play into it. And instead of just trying to shove another thing down our throat, what can we do that we have control over?
Yeah, so to that point, and something that you earlier said, one of the things that I found for myself when 12 years ago I had massive back issues, I have problem with my discs in my lower back and could hardly move. I was on painkillers 20 days a month, and sitting 150 days a year on a plane didn't help. So what I found out was when I strengthened my core and I was just able to build healthy muscle mass, everything else in life got better. When you're stronger, everything else got better. And I think a similar theme we have here, right? If the toxins go away, everything else in life would better. And if I can move properly again, everything in life goes better. And if I have all my old fluids out of my body, everything gets better. So I think these are really almost like investments in ourselves, where we're starting somewhere and then we're creating healthier lifestyles. And what I wanted to ask you, like you said, 5 years of blood, that's basically the time until everything gets basically renewed.
12 liters of lymphatic fluid.
Wow.
Has to move through your body in a day. So the average person's moving about 4 liters a day. So it's going to get stagnant. If you have 12, you can only move 4 by breathing and moving in a full day. And you're eating pizza, you're eating food coloring, you're eating sugar. Or like high sodium, which I love, all those things, but it's going to have an impact. and you swell up, you get bloated, you're like, oh my, or you know, it gets stuck in there, and you can only move it one way.
Wow. And how much do you think you can reduce that time? Like, you know, how much faster can you move it?
Well, we find that basically, after we do it, the body is kind of just flushing this fluid for a course of like 3 days. So it's between 2 to 8 pounds of water weight that the clients report that they're down. So what does that equate to in liter? It depends on their age, height, size, and weight, but it's between 2 and 8 pounds of water that they weigh less in the course of 3 days after we just kind of massage it through.
Sounds amazing.
Yeah, I like it.
Wow. I have to try it, definitely. I'm already hooked. Like, I definitely have to try this. So when we think about like this event, like what other things that you guys like really resonated with, or that you guys seen that you think, okay, this is something that we should combine with, or I want to collaborate with? Like, have you seen anything that you said like this was new?
Oh yes, I definitely did. One of the things I'm going to be working on is an esthetician school that teaches holistic health. My father was a gut biome. He's a scientist. He studies gut biome and epigenetics, and that's something that's not a lot. My dad's really big into heart. He was the president of the American Heart Association in Orange County, and teeth are heart, and our bodies are telling us something. Something we do at Facial Lounge is when someone comes with health issues, we do have them get their gut biome checked, their candida checked, their adrenals checked, their hormones checked. I work with a lot of different holistic doctors because our bodies are constantly telling us something, and estheticians are just taught to do one thing. Hairdressers are not addressing when someone's losing hair. I really want to have a school that is going to teach people to look for those things, and I am finding all my people here because eventually I want to have some great people to come in and teach. But that's something that if we have bleeding gums, it affects our heart. If our bodies are swollen, our bodies are constantly talking to us. I just had someone come in. She went to so many doctors. She had severe acne around her ears. I literally was like, when did you get your ears pierced? And she had taken her earrings out because it probably had lead and heavy metals, and it cleared up, and she was on serious steroids. So I constantly, no doctor asked her that. I mean, I'm like, how do we not ask these questions? I see people with teeth work and dental work, and then they have all this neck acne afterwards. Their bodies are totally reacting to things. So I've learned a lot, and I saw a lot of people saying the same thing, is listen to your body. It's constantly talking to you. So it's really exciting to see my people here.
I have a question to you, Holden.
Yes.
So, if I think about fascia and I'm looking for a therapist around this or someone to help me, like, what should I look out for?
I think the best thing to do is look for somebody who doesn't follow a pattern. All the massage schools are very pattern based. You do this, you do this, you do this. You go to the spa, everything looks exactly the same. When you find somebody who says, all right, I'm gonna look at you, this is the issue. I'm sorry, I'm gonna cough real quick. If this is your issue, what can we do to correct that? Where is it coming from? I'm going to focus on that, and that will get more of a result. And what techniques are they using? Because, especially with fascia, there's so many different types of treatment out there. Some are very aggressive, some are very gentle. What will work for you won't necessarily work for somebody else. So a good therapist can cater and adapt to your body, your physical state, your emotional state, how your pain threshold is. If they don't take those things into account and they're a one-trick pony and they're going to do the same thing on everybody, you're going to get hurt and you're going to have problems and you're going to have not the result you want, but actually sometimes even worse. So when you're looking for a therapist, ask them. They're like, hey, do you do patterns, or do you actually look at me? Hey, do you have more than one technique you use? And because I went to all these seminars over the years. I've been doing this for 30 years. And it's like, they're like, oh, this is the best thing ever. And you've had this problem for 15 years and I did something else. They're like, how did you do that? I said, I did something else. Because you don't respond to that.
Yeah, more of the same doesn't work.
Yeah.
How is that in your world? What to look for?
Well, it honestly varies too, because we have a lot of clients that come just for the aesthetics because they just want to be thinner after, and then we have some that come for after surgery. They've had lipo, they've had tummy tucks. It's something that most surgeons out there today are actually recommending it, and so then what we do for that person is different, and how often they come is different. We have clients that come because they're having like a hormonal issue, and constantly flushing the body helps them regulate that. So how often they come is actually different. The order of the fluid flow, which then by default the order in which we do it is going to be the same, but how often we see that person, and it's going to differ based on their needs and why they're coming to us, and yeah.
So another theme here, right? So custom, personal, personalized, right? So we see themes here.
We're super
and
general. Never.
super general, one size fits everything, absolutely. So we are coming up on time. 30 seconds, everyone, like one last thing that you want the audience to take away. Here we go, Amber.
The last thing I want the audience to take away is definitely trust your body and listen to your body. Of course, clean skincare is so important, avoiding heavy toxins and especially preservatives. Even packaging, I do a lot of stability testing on packaging. You would be surprised. So clean products, do your research, and trust your gut.
Wonderful.
You know, I think the biggest message for me that I would like to say is that just keep in mind that, you know, everything is connected. Not only are we all connected in so many ways, and we feel each other's energy. This past couple of days have just been, you know, we've been riding high just with the wonderful people who are around, learning from everyone. But our body is so connected in every way, and if you're not conscious of not only what you're putting into your body from food and wonderful water or everything else, but also, of course, you know, like I said, the materials that we're using in the world of dentistry, but also, as Ben pointed out, your thoughts every single day are so important in how you're talking to yourself. This is all toxicity. And where I live right now on a day-to-day basis is how do we reduce the toxic load? So these are all little factors that I care about so much, and this is all that would be my message.
Wonderful. Holden?
I think just realize that just because you're hurting in one place, it's not coming from there. It doesn't have to be that one space. So if you've got your pain in your hand, why is it there? Well, maybe it's because your elbow and your shoulder are messed up, or maybe you've been doing something else. Because Western medicine's so hyper-focused on symptom, treat that symptom. Trust yourself. You know where it's coming from. You know there's something else. And be open to looking to a little bit bigger picture, and that way you can heal better.
Beautiful. Tatiana? Last words?
I'm with you on that. I think that, you know, we live in a day where doctors just want to pump you with medication. I recently went through it. I'm in very early menopause, and I got really, really, really depressed, and I had no idea why. And I'm usually a very happy person, and I had to be my own health advocate. Like, I could have easily gone and gotten on some Prozac or something else, and I dove deeper, and I found out that I was lacking so much hormones that it caused this like psyche. And just be your own health advocate. Research, research, research.
Wonderful. Thank you all. This was amazing. Have a great day, and yeah, enjoy the rest of this week. Take care.
Thank you.
Thank you.